We'll do something called finger to nose. We'll have you touch your nose. If you go to touch your nose with your eyes closed using the pinky and you miss, or you come in and you have this little shake at the end, it's highly indicative of a cerebellum that's not working the way it needs to work. We may do something called pass pointing, where we have you come up and try to touch your fingers together or out in the front. Do they touch together with your eyes closed, taking away the visual system? We'll do a number of different balance tests. We'll put you on a balance platform. The other thing we'll do is what's called video nystagmoscopy, which we use what's called these real eyes goggles. And what we do is we put these goggles on, and there's an infrared camera that slides in here. And what we'll do is we'll videotape your eye movements. And basically what will happen is we'll look and see how well your eyes are moving and how well they match up. So we're going to really check this visual system. Not so much as to how well you see, but how well your ocular motor system is working, how well these muscles are moving. So what we'll do is we'll put this on and we'll spin you round and round. When you spin, your eyes should bounce. They should be pushed the opposite way that you spin and then quickly come back again. And so they should do this. Now, if we spin you to the right and your eyes are kind of not doing that, they're kind of just quivering, we know you've got a right cerebellum that's not firing well. We'll also put these on and we'll have you look from one target to another target and see that when you go from one target, does your eye actually stop on that target, or does it overshoot the target and then come back, which is indicative of a cerebellar problem. We can also determine and see if you have decreased frontal lobe firing, which is the front aspect. People that feel like they are spinning, or they feel like they are kind of leaning or tilting to one side, meaning that the world is not spinning so much, they're the one that's moving, they typically have a cortex problem or a mesencephalon problem. And so we can determine that through our testing. We'll do olfactory testing. We'll do what's called optokinetic testing. Optokinetic testing means we're going to actually have you look at some different tapes and see how well your eyes are moving and tracking. That is a cortical test mainly. It's also a cerebellar test, but it's mainly a cortical test. And so we're going to look at you neurologically. We're also going to look at you metabolically to find out exactly what's happening, looking at your blood work and whatnot. I'll talk about that a little bit more when we talk about treatments. We'll do muscle testing. We'll do smell. We'll do what's called pinwheel, which see how well your sensations are working. And so what we're going to do is we're going to determine neurologically why you have the problem. We're going to find the functional reason why you have the problem, because most doctors, medical doctors, are typically only looking for the hard lesion. If you don't have a hard lesion and you don't have a problem with your inner ear, then there's this big gap in the middle. It's a central-based, non-pathological lesion that's causing your problem. And typically what they say is, we don't know what's causing it, must be a central problem, take this medication, learn to live with it. What we're going to do is we're going to tell you what's causing the problem. So what I'd like to do now is talk to you about our treatment program. Okay, treatments. So what are we going to do to treat your balance disorder or your vertigo or your dizziness? Well, first off, I want to let you know that all of the treatments that we're going to do are going to be specific to the areas of your brain that we find are weak, are not functioning well when we do your examination. So we're going to look at the different aspects. We're going to look at the different lobes of your brain, left and right side, frontal lobe, temporal lobe. We're going to look at the cerebellum, different aspects of the cerebellum, the middle of the cerebellum, which controls a lot of balance and coordination. We're going to check your inner ears. We're going to make sure that you don't have BPPV. We're going to see if there's a otoconia debris that's causing your problem, which we call a peripheral problem. We're going to check your spine. We're going to check your muscle and joint feedback system. We want to make sure that your feet are functioning well. And then what we're going to do is we're going to give you specific treatments based on those areas. The whole goal is to develop what we call neuroplasticity. Now, the word neuroplasticity, if you notice, has plastic in it, and plastic means moldable. And basically what that means is that the brain can change. No matter how old you are, the brain is always changing based on the specific stimulations that are given to it. So if we find an area of your brain is weak, let's say the left cerebellum, we'll stimulate the left cerebellum, and we are trying to develop healthy neuroplasticity, which that basically means is we want to get that area stronger, we want to get that area more efficient, we want to develop better synapses in that area. So I always talk about the Charlie Brown Christmas tree, and if you look at it, versus a real bushy, healthy Christmas tree. People that have decreased function, it's like their nerves are kind of like the Charlie Brown Christmas tree. They're just not, the electricity is not flowing through those nerves properly. But if we can stimulate them and we can get them functioning better, we can develop healthier, bushier synapses and nerve sprouts and healthier neurotransmitters. That's what we want to do. If there's an imbalance on one side versus the other, we're going to get that side up to balance it, and that's going to create more balance in your body. It's going to create less vertigo, and that's the goal. So what are we going to do? Well, the brain needs two things. Your brain needs fuel and it needs activation. Fuel is in the form of glucose, which comes from the nutrition in the food in your metabolism, and it also is in the form of oxygen. Oxygen is fuel for your brain. Your brain needs oxygen. That's why if you have a stroke, you cut off the oxygen supply and your brain tissue dies. One thing, before we get into fuel and activation, I talked about how heart lesions like strokes and MS and tumors and things like that are things that can cause dizziness. Well, you should definitely get those things checked out. But let's say you have a stroke, you've had a stroke years ago, and it is maybe the culprit in your dizziness. It doesn't mean that we can't take care of you functionally. It just means that, hey, you need to get that checked out first to find out if you've had that problem. Same thing with MS. Some people have some MS that is undiagnosed, which may be causing some problems also. So what I'm saying is you need to get a thorough neurological exam medically prior to coming in to make sure that if there is a heart lesion, it's taken care of that way. So we can take care of patients with pre-existing heart lesions, or the goal is to find out what type of soft lesion they have. So again, brain needs fuel and it needs stimulation. So the fuel is very important. So we put all of our patients on oxygen therapy.